welcome to Wellness Wednesday. I'm here with Jill Rosner. Hi, Jill.
Hi, Laurel.
Thank you so much for being here today. I know you have a crazy busy life and you had a crazy busy day. So we are very lucky that all the stars aligned and allowed you to be here.
Yes, finally.
Finally, yes. So I'm going to do a little introduction of Jill, and then we're going to have a great conversation. You're going to learn tons from her. So Jill has her BSN in nursing from the University of Maryland, Baltimore. She's an RN and a certified case manager and an aging life care manager. She's been the owner of Rosner Healthcare Navigation since 2007. We actually met probably a little bit before that, maybe 2006 or so, in a meditation class. And then we crossed paths many times in the healthcare world and shared clients. And I called you in crisis at least twice saying, you know, somebody, a friend, a client needs you desperately. And you came like Wonder Woman to the rescue. So I'm thrilled to have you on here tonight.
Thank you for having me.
Yes.
Glad to be here.
So tell us a little bit about the person behind the titles and the certification. So we know you're a nurse. We know you're an entrepreneur, a business owner. What else do you like to do in life?
So just to let you know that before 2007, when I started my business, if you told me that I was going to have my own business, I would have said, I mean, what would I be doing? So it was really a sort of transformation from my previous nursing life as a labor and delivery nurse to sort of evolve to this. And so here I am now. I have a busy practice and I love what I do. In my free time, I don't have a lot of free time, but when I do, I love to sit on my beautiful front porch and sit outside and especially have my coffee in the morning out there, at least on the weekends. I love to work in my garden, and I have a little 2-year-old granddaughter. I have a 3 and 5, almost 3 and 6-year-old grandchildren in Kentucky. So I like to spend time with them. And so I used to love to read, and I'm finding less and less time to do that. But in any case, those are some of the things that I love to do outside of working. But I do seem to work a lot because there's a lot of need out there right now.
Yeah. So what drove you into nursing initially? And then what had you pivot to find this as your new business and direction?
So I think I always felt some connection. I wanted to do something in healthcare and I always wanted to be a nurse, and went into nursing. And in nursing school, my passion was labor and delivery. That rotation, I decided I was going to be a labor and delivery nurse. I went to the University of Maryland School of Nursing, downtown Baltimore, did my rotation in labor and delivery, loved it, worked as a labor and delivery aide through nursing school, and then got out of nursing school, stayed on at University of Maryland as a labor and delivery nurse for many years. Had my first child at University of Maryland, got married, had my first child at University of Maryland. And then as time went on and I had 2 more children, eventually I transitioned to a community hospital out here in Carroll County, working per diem. And at some point it was difficult working nights with kids. And so I had this opportunity to work as a research nurse for the University of Maryland School of Medicine. And I will tell you that it was a really kind of crazy transition because I went from labor and delivery to working with aging people who have broken hips. And I, in nursing school, did not like orthopedics. I was scared to death of broken bones. And so it just turned out that I got this opportunity to work for School of Medicine doing research nursing and loved it. I worked with people over 60 who had broken a hip. I followed them every other day to various nursing home or long-term care situations where they were there for rehab. Many of them transitioned back to home. Some of them had to stay on, and they had lost their independence from the hip fracture, and they stayed on in the long-term care. And I just saw such a need for navigating people through the healthcare system, because people would say to me, what do I do now? My mother broke her hip. I don't think she's safe at home. Where do we go from here? And I really couldn't jeopardize the study, so I couldn't give information out. And then as I started to wrap up and we had enough of enrollees in the study, it was time to move on. I decided to create my own business to really help navigate people through the healthcare system, whether it be with aging issues or chronic illness, acute illness, and eventually started working really with people with disabilities, younger population. I do have a significant amount of clients who have mental health issues, that's a really difficult system to get through. The mental health system is extremely difficult, and there's really a lack of care in the mental health system. It's really a broken system. So I work with a lot of different populations.
Right.
So that's how I got started in my business. And so here I am.
Right. So before that meditation class, I think we had gone out to lunch, and you were sharing, these stories about how people are in crisis, or they kind of are at a gap in the road, and they don't know which way to go, and they don't have the right guidance or the right information. And there is such a need for someone to step in and hold their hand at that point. And you saw that need. And I didn't know that this was a profession that existed. So did you know that this was a profession before you saw that there was such a big need for it?
So funny story. No, I thought that people needed someone to navigate them and advocate for them. So my first business card was Jill Rosner, patient advocate. I will tell you that went over like a lead balloon in the medical profession, because physicians, if you say I'm here as an advocate, they immediately bristle and they do not want sort of what they perceive with what their perception of advocate is someone who is going to cause them trouble. It's going to be a longer visit, and it's going to be a problem. So that then through that, I evolved in saying, how am I going to navigate people, and became case management certified, so that I could really provide case management, getting people to where they needed to be, and became a member of the Aging Life Care Association, it used to be the National Association of Professional Geriatric Care Managers, which, besides being a mouthful, nobody likes to be referred to as geriatric. And the profession actually is so much more inclusive than geriatrics. I have had people as young as in their teens and as old as 112 years old. So there's a huge broad lifespan that we cover that was really not included in that title. So it really just evolved. And so now I'm known as an Aging Life Care Manager. A lot of people do not know we're out there. It's nationwide. If you want to find a care manager for a loved one in another part of the country, you go to the Aging Life Care Manager website and you put in a zip code, and you can find a care manager in any part of the country that can help you to navigate through the aging or healthcare process.
Yeah. Thank you. I'm so glad that I knew you and knew to call you when we had, a situation with my in-laws in New Jersey, because there are people like you around. But typically they're social workers. Is that right? You're sort of special in that.
So yes, there are a lot of social workers who are care managers. There's some other people in other fields, occupational therapists, physical therapists, rehab counselors, that kind of thing, who also do care management. There are other nurses who do care management. I would say that probably the majority of care managers are social workers. So in that sense, I'm I'm unique in the sense that I have that nursing piece. So I can fill a gap sometimes in the home with that nursing piece, as long as it's within my professional abilities.
Right, right. Well, thanks for giving us that background and that picture. I think that's information that a lot of people can use and benefit from now or later. So put a pin in that for anybody who might need that 5 or 10 years down the road. So we're going to transition a little bit. So June is our Alzheimer's and Brain Awareness Month, and I'm honored to have you as our Wellness Wednesday on this last Wednesday in June. I know that many of your clients have dementia, Alzheimer's, memory issues. How often do you see that in your client base?
I see it too often, unfortunately. I would say a majority of my clients have some kind of cognitive impairment. And whether that is Alzheimer's disease leading to dementia, or Lewy body dementia, Parkinson's, a young onset frontal temporal lobe dementia. And I think it's really important for nobody understands, hardly anybody understands dementia versus Alzheimer's. So many times Alzheimer's is just the label associated with dementia. And so Alzheimer's disease is the disease process which causes the symptoms of dementia. And Parkinson's disease, Lewy bodies, frontal temporal lobe dementia, those are all the diagnoses which cause the symptoms that you see in someone with dementia. So we use Alzheimer's disease sort of interchangeably with dementia, but it's really the disease process that causes the symptoms of dementia, the memory problems in some, the executive dysfunction, the really a whole cascade of symptoms, that behavior problems and that kind of thing that go along with dementia that are caused by another disease process.
Right, right. You wrote an article back in 2006 with that title that you just mentioned, the difference between Alzheimer's and dementia. So if anybody is looking for more information, that's still available online. And that was a really helpful article and kind of described in more detail what you just shared.
Right.
And you mentioned in that article that some of your clients are, young, less than 65. And the first sign of dementia isn't necessarily memory loss.
Yes.
Yeah.
And that is quite frequent with the younger population. I wish that I could tell you that the numbers, if you look up, what's the incidence of young onset under 60, 65 of dementia. If you look it up, everyone would feel really sort of like, oh, that's not going to happen to me. That's, the numbers are really insignificant. And I will tell you that the numbers are not capturing all the people we're seeing. The numbers have not caught up to what we're really seeing. It's so unfortunate. We're seeing a lot of young people. We're seeing people in their 40s, 50s. We're seeing people with kids in elementary school and high school. And it's really concerning. So for those of us who know that there's a huge problem out there, we've developed a very grassroots nonprofit organization called YES, Young Onset Dementia Education and Support. Really reaching out to the loved ones and support people of people with young onset dementia. It really was the brainchild of a woman named Deb Hanna, whose own mother developed dementia. And she was actually my intern. She went to McDaniel College and did the certificate in aging and was an intern for me. And then went on to become very involved with the Alzheimer's Association and very involved to begin this young onset group. And it's really grown. It started in Carroll County, and yet we have people who are tuning in nationwide because it's a huge problem. People who have spouses who are still working and trying to take care of kids, and they usually the way it's diagnosed or caught is the family sees subtle things, write it off to stress or being exhausted or just, depression sometimes. And then we see that these people lose their jobs. And that's usually the first thing that people see, is that there's a job loss because people, their work environment doesn't even realize what's happening. They just think, oh my gosh, this person's been here 20 years and what's going on with them? And they get fired. And as they progress in the disease process, it becomes more and more evident. And in some forms of dementia, like frontal temporal lobe dementia, we don't even see memory problems as the salient feature. We see things like executive dysfunction. We see inappropriate behaviors. We see, you lose that screen on your mouth and you say things inappropriately. We see people who can't follow the steps to do things that they once were able to do. So somebody can pass a mini mental exam, which only indicates amnesia or memory problems. We don't pick up on a mini mental exam the dysfunction that comes along with young onset dementia a lot of times. That's really more about executive dysfunction, cognitive loss that presents in behavioral variant problems.
Yeah. So a case that I'm familiar with, a client who in her 40s, her first sign was struggling to recognize people's faces at work, and was able to hide it. But then started to realize that other people were noticing her inability to connect name and face with people that she'd worked with for years, and mentioned it to her doctor, and the doctor sort of blew it off like, meh, you're stressed, and
Yes.
2 years went by before they really did any investigation. And now, a couple years down the road, significant improvements, but we found Lyme, we found a house full of mold, we found glucose levels that were too high, and are finding all these things that we can address to help the inflammation in the brain that was triggering all these issues. So there's help, but it's a big process to figure out each person individually what's going on. And ideally, we prevent these issues 20 years ahead of time.
Right.
Yeah. Yep. So changing direction just a little bit. So you've had years of experience, first as a nurse and now as a care manager. You've written many articles, and I've heard some really good advice come out of your mouth. So I might chime in if there's things that I'm thinking that you don't say, but if you could have, your best advice for either adult children or spouses who are currently in the role of caregiver, what would you give them in terms of advice to what to expect that loved one might need, how you can plan ahead, advice? What do you got?
Wow, I can give a lot. I'm not sure where to start. I would say, first off, get help. Get help. Don't be a martyr. Don't say, I've got to go through this alone. It's my mother, it's my spouse, it's my job. Get help. There is help out there. You need to know where to find it. So get help, and do not take the answers that you know are not correct. Like you said, you go to the doctor. I can't tell you how many times, whether it's young or aging people, that I've been in a doctor's appointment with someone and the doctor's had a relationship with this person for many years, and they don't want to be the bearer of bad news. They don't want to believe that there's anything wrong, because what they see in that 30-minute or less, 5-minute sometimes picture in front of them does not look like there's a problem. It looks like the same person they've been following for the last 5, 10, 15, 20 years. And so they say, oh, you're really stressed. You're a little depressed. You're anxious. You're getting older. People start to forget things when they get older. They help people to stay in that stuck place where the family knows there's something wrong, the client often will say, or their patient will say, I'm not worse than anybody else who's older and aging, and my brain is getting older. Or a younger person may say, the doctor said I'm fine. Or I've actually sent people for neurocognitive testing who have gotten a report back that when I read it, it says there is cognitive impairment, but because it says there's no evidence of Alzheimer's disease, they take that to mean I'm fine. Well, just because you don't have Alzheimer's type dementia doesn't mean that you don't have vascular dementia because you had a little mini stroke or you had a massive stroke many years ago. Doesn't mean you don't have frontal temporal lobe dementia. That little one line that says this is not indicative of Alzheimer's disease really pacifies a lot of people. So a physician may see someone in the moment and ask them some question, who's the president, what's the date? And they may be able to answer that. They may be able to pull off looking pretty good in a doctor's appointment, and the family's saying, oh my gosh, they turned off the stove, they burned something on the stove, they call me 10 times in the evening, they start sundowning and they start calling me incessantly. We found her outside her house walking around, and the doctor says, looks like you're fine to me. So I think you really need to keep pressing on and getting more answers. You need to find the help. You need to talk to other people. There's help you can ask questions through your local Department of Aging. You can get help through the Alzheimer's Association. You can call a care manager. You just put in your zip code and you find out who's available out there to help start to navigate you. And just seeing your primary care is sometimes not good enough. You just need to make an appointment with the neurologist. The neurologists, I find, are backed up for months. A neuropsychiatrist, they're even more backed up. They have waiting lists. So you just need to keep pressing forward. And really the complicating factor a lot of times is that the affected person doesn't have any insight. They don't have any judgment. They don't have any insight. They say, I'm fine. There's nothing wrong with me. And that becomes a problem because families seeing it and they're trying not to rock the boat. And they're just letting this unfold in front of their eyes. And it gets to the point where it becomes sometimes very unsafe and dangerous.
Yep. So you did touch on the one thing that I wanted to make sure that we shared, and it relates directly to my personal experience with my mom and dad. My mom was early in dementia, and my dad said, I promise. The promise.
The promise. That was my very first article. Did you know that? That's my very first article. The very first article that I wrote was The Promise.
Yep. I promise I'll never put you in a home.
I made that promise to my very own mother. And so what I tell people now to sort of educate them ahead, don't make the promise to start with, and if you did make the promise, you have to know that things change and evolve. And unless you've done this work, unless you've taken care of people who have dementia and you have seen it from beginning to end, you cannot make the promise. And if you have to understand that things change and evolve that you will never, ever, ever be able to foresee. So the people who put a big grand, addition on their homes so that they can take their parents in, take care of them. You'll just live with us, mom and dad. And then maybe dad passes away and mom's with you and mom's up all night. Mom's up all day, mom's up all night. Mom is falling down the stairs. Mom is not able to identify where the toilet is. Maybe she's incontinent and uses Depends, but maybe she's using a garbage can in your kitchen. Things like that you will never, ever be able to anticipate start to happen. And you either have to be able to say, I'm going to bring in help to my home, which is really hard for people to have caregivers coming and going, or I'm going to place mom and dad. And if you're going to place mom and dad, will you have the financial resources after you've brought them to your home to be able to place them? If you have to place them, there's so much guilt with family members because you've said, I promise that I will never put you in a nursing home. Well, if it's an unsafe situation and you cannot be there with your parent 24/7, then there are limited options sometimes. And that becomes a reality.
Right. Yeah. I mean, for 2 of the 4 kids, we were very close or eventually in the same house. But my dad was just wearing himself down. And then he had heart problems, and we're like, Dad, you can't kill yourself trying to take care of mom. And for a little while, we just upped the help. But it then fall down the steps, broken shoulder, multiple UTIs, then C. diff, then, the whole cascade.
Right.
Went to rehab and fell the first day at rehab and broke her hip. So that was really, but fortunately we had the foresight a year ahead of time when my dad had heart problems to say, we're going to put her name on the list because we need a backup plan. So it was good that we had that backup plan. And thank you for writing that article. And
You're welcome.
Forgiven himself and knows that it was something that we had to do. And she got great care, and he was able to be her spouse again and hold her hand and love her and not have to clean up her dirty diapers,
Right.
It was really turned out to be a gift for everyone involved.
Right. And I find caregivers become aides and robots, and they're just doing all the medical piece, the cleanup piece, like you said, and they no longer have the time or energy to sit and hold their hand and watch TV with them or read a book to them or just talk to them because they're so busy doing. And sometimes it's just so exhausting, they become resentful and, and then they feel guilty about that.
Yeah.
So
one of these pieces that kind of goes along with the advice is kind of planning an elder care attorney, which I didn't know. Am I using the right terminology?
Yes. Elder care. Yes.
Yeah. So that's been helpful in my in-law situation to help with guidance, and
that's really helpful for the financial piece and making sure all of the pieces are in place as far as advanced directive, living will, the most form. The most form is not a legal form, it's more a medical form, but it is based off of the advanced directives that are written. And I can tell you, for the people who put that off, who keep saying, I'm fine, I don't need to do that yet, or they feel like that's so ominous to your advanced directives, that putting that off really puts themselves and their family in a difficult position. And I have a client who's so funny. She said to me, you know what? I did my advanced directives a long time ago, and it didn't make me die one day faster. So I think that's really important to remember. If you put it off, you can get yourself into a very difficult position. With people not having any direction whatsoever on what you want.
Right.
And I've had families who have multiple children, like 10, and couldn't agree on things. And so who suffers in that? It's the parent. It's the person who needs the care. That 10 children can't all get together to make the decision. So you give the power of attorney, you give the medical power of attorney to your not weakest link, to your person who will stand by your wishes, and you give the financial power of attorney to the person who you feel that you can trust to work on your behalf. Some people give the medical and financial power of attorney to the same person, and some people give it to 2 different children. I just always say, if they are children who do not agree and get along, do not put 2 adversarial people in charge of 2 different plans.
Right. So maybe another Wellness Wednesday, I can have a elder care attorney on. That might be a good thing for down the road.
Yes.
So I'm personally in the business of functional medicine and health coaching for early intervention for dementia and prevention. So when my mom started with dementia, the only thing that it was recommended was exercise, but she had chronic fatigue syndrome. She couldn't exercise. It made her worse. We hadn't figured out the just right challenge for what exercise she could tolerate. But things have advanced. We're still in very early days of the research. You getting a big storm there?
I am. Are
You
you?
do. Yes, that's good.
Wondering.
It needs a drink.
It does, but I'm kind of wondering if we're gonna all of a sudden be gone.
No lightning yet. No lightning yet. We're
We
getting,
have lightning here and a lot of thunder. So
Oh, okay.
yeah.
maybe it's
So,
coming in my direction soon.
yes.
So we have only a few more questions to get through. Hopefully we can survive, keep the electricity on. So in any case, the research has evolved. It's still in early days, but there is significant evidence, evidence, and hundreds of people now have either reversed their dementia or reversed and maintained for 5 years. So, but when they go off the program, it comes right back. So there really is a lot of lifestyle adjustments that are required to improve brain health. So for those who are ready to take action to protect their brain, do you have any good advice for that group of people?
Can you give me 1 minute? Because I have a 2-year-old entering my house and it's going to get loud. So I'm
Okay.
going to have to shut my door. Okay.
Sure. So I'm going to take a minute and look and see if we have any questions that have come in for Jill. Do we have any questions? I'm looking to see, Jill, if anybody's made any comments and has a question for you.
Okay. I'm back. I shut the door to my office so that if it gets loud.
Okay. No questions at right now. So, okay.
Okay. So
Best advice for someone who's ready to take action to protect their brain.
I think you have to start early. Like you said, I unfortunately, most of the time that I see someone, it's not when they're starting early in this situation, their journey. I get calls from family members when they're a little further down the road. If your loved one is in a position where they can no longer care for themselves, or their ADLs, what we call activities of daily living, which is bathing and dressing and getting around and toileting and, all of those things, you can't expect someone to make those lifestyle changes when they are at the point when they're very impaired. Because at that point, most people with dementia, they want to satisfy their senses, and the taste that's prevalent is sweet. So people, lifestyle change wise, are not making good dietary changes. They're eating all the sweets they can find, and they don't want to eat healthy food. Some people with dementia are walkers. They walk and walk and walk and pace and pace and pace, which it can become a problem. But that's not the time to try and make, if you're going to make a choice like that, you have to really be living with the person and really control their environment. So the time to do that is start early. Right. And look at prevention. And if there are signs early on, then begin immediately, before the process it's too far down the road.
Right. Prevention. Yes. Right. And that's what we talk about over and over in the in this group. So If anybody has questions that they need answered, feel free to reach out. But I pull this book out with regularity, lots of information here in the Dr. Dale Bredesen's book. This is his latest one, the End of Alzheimer's Program. But this is the information in here that's come through in research. There's 2 programs, one called a ReCode to essentially and hopefully to make improvements in someone who's already demonstrated symptoms of cognitive decline. And pre-code is the prevention for someone who might have a family history and say, you know, they had like me, my mom died at 77 and now I'm 47. And I would like to start taking action now to prevent hopefully the same fate. So I know I have this genetic link, and starting early is critical. So brain changes occur decades ahead of time before symptoms show up. So again, we're going to both shout out prevention. So I think I got to all the questions. Is there anything that I didn't? I want everybody to make sure that they can contact you if necessary. But before we get to those details, is there anything else that you want to share that we didn't talk about?
No, I think that we've covered a lot.
Covered it all. And your granddaughter's nearby and it's a storm. So.
Right. Anything could happen at any moment.
Anything could happen. So if somebody is in need of your services, how do they find you?
So they can look on my website, Jill Rosner. Actually, my website is Rosner Healthcare Navigation.com, but my email is Jill@RosnerHealthcareNavigation.com. I'm sorry it's so long. When I started my business, I didn't think to abbreviate. So Jill@RosnerHealthcareNavigation.com. My number is 410-591-6378. And I will tell you the best way to get in touch with me is to text me, because when I'm with clients, some days when it's a long day, like today, I will go eat dinner at 8 or 9 o'clock. And if I get messages, I'm not going to be able to return them until the next day. And if I get busy in the middle of my day, it might be late in the day. So the best way to get in touch with me is to text me. You can look at me on my website. If you do send a message through my website, unfortunately, sometimes they go to spam through the website. But email, text, call, those are the ways to reach me.
Okay, awesome. Thank you for doing what you're doing and, you know, helping to make the world a better place. And
thank you.
You have, you know, certainly helped people that I know personally. So we're grateful for that. And
well, thank you. I hope sorry, my phone. A little spam right there in the middle. I forgot to turn it on to vibrate. So thank you for what you're doing. It's great to have a resource finally for people who want to try and start doing something now. You know, I hear from people, what about, you know, these programs? And I'm thinking, you know, it's not likely that people are going to succeed without support.
Yeah, I say health is a team sport. You know, it's hard to do by yourself.
Yeah,
your friends and all your support network. Yeah.
Yes, it's great. So
thanks again, Jill. I hope to chat soon.
Thank you, Laurel, and go enjoy and appreciate the storm and the water.
Run in the rain. It's one of those days where that feels good.
Yes. All right. Take care. Thank you.
Bye.
Bye-bye.